Assalamu alaikum and good morning to one and all. So today we'll study about part 2 of antidepressant drug. So before going ahead, let's quickly revise what we have studied in part 1 of this chapter. So in part 1 of this chapter, we have studied what do you mean by depression, and we have seen that the depression, it is basically a disorder of mood rather than disorder of a thought. So psychosis, it is the disorder of thought, whereas the depression, the major effect it is on the mood. And we have seen there are two types of mood disorder. First one, it is the depression, and second one, it is the mania. And sometimes mood it is swing from depression to the mania, and in such case it is called as bipolar affective disorder. When depressive patient, his mood it is swing from depression to mania, it means he is suffering from bipolar depressive illness. So this is what we have seen in case of the depression. Then we have studied the two important type of symptom, that is biological symptom and emotional symptom of depression. So there are different biological and emotional symptom of depression we have studied, and we have studied different theories of depression. So most important theory of depression that we have studied was monoamine theory, where there is effect it is seen generally in case of monoamine like 5-HT and noradrenaline. So key mediator it is the 5-HT. So depression it is due to functional deficit of this monoamine, whereas the mania it is due to functional excess of the monoamine. So this is what we have studied in case of last chapter. So I am Professor Sheikh Abu Sufyan. Welcome you to AS Academy Learning Forever. At the end of this e-learning session, you are able to explain indication for the treatment of antidepressant drugs, give its classification and mechanism of action, explain pharmacology of tricyclic antidepressant and selective serotonin reuptake inhibitor, that is SSRI. So let's start with clinical pharmacology of antidepressant drug. So most important thing when we give the treatment to the patient suffering from the depression, it is the very important question, when to give the treatment to such patients or when to give antidepressant drug. So it is very important, because antidepressant drug it is not only given in case of the depression, but it is also given in case of the diseases which having the symptoms or the characteristic feature which is in same line with the depression. So first and most important indication of this, it is the panic. When patient having the behavior of the panic, so he get panic frequently. Now what do you mean by panic? So the panic, it means there is the sudden fear. Whenever there is sudden fear, it is called as panic. For example, if you are moving in the forest and if you have seen the tiger, so what will happen to you? So that fear, so that is sudden fear, because you have not considered that, or you have not thought of getting or you seeing that tiger, isn't it? But suddenly when you see the tiger, whatever your condition is, that is called as panic, because that is sudden fear. And due to that sudden fear, you are not able to think what to do, whether to move away from here or to fight with that tiger. So if that is the case, it means you are suffering from the panic. Likewise, second symptom, it is the phobia, in which also you can give antidepressant drug. Now what do you mean by phobia? Some people, they have the phobia of water, right? So if they are going into the sea, the moment they keep their foot into the ship while going into the sea, what will happen to them? There will be the phobia, because they are having the phobia of the water. Likewise, some people, they may have the phobia of some animal, like you might have also experienced, like at your home, maybe your sister or your mother having the phobia of the cockroach, isn't it? So this phobia of the cockroach, it is not a usual, right? So it is not seen in all patients. The normal patient should not have the phobia to the cockroach. But if the patient having very severe phobia to the cockroach, that means there is the fear to the cockroach, that indicates that he is suffering from the phobia. So antidepressant drug can also be given for the treatment of the phobias, right? So these are the two important indications in which antidepressant drug can be given. In addition to this, antidepressant drug can be given in case of the OCD. What is OCD? OCD, it is obsessive compulsive disorder, right? So for example, you have the anxiety, right? And you have locked your door and you have came down. Okay, so you are staying at second floor, and you came down, you have locked your door, right? And when you come down, there is fear in your mind which is coming, and you are thinking whether I have switched off geyser or not, whether I have switched off my gas plug or not, isn't it? And that fear, it is forcing you to take certain action. Like आपने door lock किया था and you have locked the door and went down, isn't it? Now what is the action? You are coming back, opening the door, and you are going into your bathroom and checking whether you have switched off your geyser or not. Okay, likewise you are checking whether you have switched off your gas plug or not, isn't it? And when you come back and see, you observe that it was already switched off, right? So what is this? This is called as obsessive compulsive disorder, where there is certain fear is there, along with there is partially loss of the memory, or there is confusion, or you are in ambiguity whether you did or not, isn't it? And those ambiguity or the fear forcing you to take some repetitive action, that is called as obsessive compulsive disorder. So in such case also you can give antidepressant drug, and obviously you can give also in case of the disorder of the mood, that is the depression. So these are three indications for the giving antidepressant drug to any patient. Now let's see how to choose this medicine and what should be the strategy for choosing the right medicine. So drug of choice, it should be chosen on the basis of first important thing, it is tolerance to the side effect. Because remember that the antidepressant drug first doesn't produce therapeutic effect, it first produces the side effect. So how much patient tolerate that side effect, it is going to decide what type of drug you are going to select. Because first choice drug mostly it is tricyclic antidepressant. Then maybe you can go over to the selective serotonin reuptake inhibitor, or maybe go over to the monoamine oxidase inhibitor. So all these, it is depend on how much side effects it is tolerated by that patient. So first thing, it is the tolerance to side effect. Second thing, it is the past response. Like you have given treatment for the 2 weeks. Now after 2 weeks, that patient is again go back and visited to psychiatrist, and now the psychologist or the psychiatrist will see based on some question how much that patient showing improvement to the treatment with the antidepressant drug. So if there is good amount of improvement, you can continue with the treatment. If not, then you can think of switch overing to the another drug. So this is switch over to another drug. It is not done suddenly. It is done gradually, or maybe at least you wait for 4 weeks of the treatment, and after 4 weeks of treatment, if you see there is no effect of that particular drug, then you can switch over to another medicine. Third thing, it is drug-drug interaction. Because patient suffering from the depression, he may also suffer from other disorder like hypertension, diabetes, and those drugs who is patient already taking, if it having interaction with your antidepressant drug, then obviously you need to change that medicine so that there should not be very severe drug-drug interaction. So the drug of choice, it is depend upon the tolerance to side effect, past response, and drug-drug interaction. Okay. Next one, it is treatment. How far you are giving the treatment? So antidepressant drug treatment, it is generally not an the 1 day or 2 day treatment, but it is given for the long period. Okay, so the treatment, it is given for the long period. So the treatment, it is generally for 1 to 6 months. Okay, so not it is like you are giving just for a week and then it's showing the effect. That is not the case. So it is the long term treatment it is given. Secondly, you need to change the drug if no improvement. So if there is no improvement in first few weeks, like you have started with maybe your tricyclic antidepressant drug, and if you see that there is no improvement in first few weeks, then you can change that drug, you can switch over to another medicine. So likewise you can adopt the strategy. Another important point that you must remember as a pharmacist, all antidepressant drug, they carries the black box warning. What is the black box warning? So black box warning, it is the warning written in the black box on the package of antidepressant drug. And what is that warning? The warning is it may produces the suicidal thought and the behavior, isn't it? So it is generally written in all those drugs which produces the suicidal thought or the behavior. So likewise, it is also written on the package of antidepressant drug, because antidepressant drug, they produces the suicidal thought or the behavior that is very dangerous, and that one must supervise. If that is the case, then again you can switch over to another treatment, right? So giving the treatment of the depression, it is not an easy task. It is very challenging. On trial and basis, you have to try. You have to see the improvement of the patient. You have to see the side effect of the drug, medicine. And accordingly, you can switch over to another drug, or maybe the appropriate combination that can be well suited for that particular patient. So likewise, you can adopt the pharmacotherapy of the depression. Okay. Now I am going to the classification of the antidepressant drugs. So let's see how many classes are there and what are different classes. So there are three classes of antidepressant drugs. They are generally given to the patient. So the category A, it is basically the inhibitor of the monoamine uptake. Okay, so inhibitor of the monoamine uptake. So we'll see later on the mechanism of action of this. So there are different category of the drug which having this mechanism. They inhibit monoamine uptake and increases the level of monoamine. So the first category, which is very important and widely used, or we can say the conventional antidepressant, are tricyclic antidepressant drug. So with the name only you can realize it consists of the three cyclic structure, isn't it? So two benzene ring, it is attached to the in between 7-member ring. So that is the basic structure of tricyclic antidepressant. So very good drug which is widely sold in the market is the imipramine and amitriptyline. So it belongs to the category of the tricyclic antidepressant. Second drug, it is selective 5-HT reuptake inhibitor. So 5-HT, it is also called as serotonin. So it is also called as selective serotonin reuptake inhibitor, because it produces selective reuptake inhibition of the 5-HT, not noradrenaline. Whereas tricyclic antidepressant, they produces the reuptake inhibition of both noradrenaline as well as 5-HT. Whereas SSRI, they produces the inhibition of the reuptake of only 5-HT. So they are called as selective serotonin reuptake inhibitor. Example, it is fluoxetine and paroxetine. Third category, it is not a third category. So this is the category 1, that is inhibitor of monoamine inhibitor, which consists of two categories, TCA and SSRI. Now second category, it is monoamine oxidase inhibitor. So monoamine oxidase inhibitor, these are the drugs which basically inhibit the enzyme which is responsible for metabolism of monoamine, like noradrenaline and 5-HT. Since it inhibits this enzyme, there is no metabolism of noradrenaline and 5-HT, and that is why it increases the level of both noradrenaline and the 5-HT. So level of 5-HT and noradrenaline will be increased, and that is what we need in case of depression, because depression, it is due to functional deficit of this monoamine. Okay, so again they are non-selective. Example, phenylazine, tranylcypromine. Okay, second, they are the selective, which can block selectively monoamine oxidase A enzyme. Example, moclobemide. Okay, so these are the category second, that is the B category, which produces monoamine oxidase inhibition. The category C, it is the miscellaneous antidepressant drug. Their action, it is poorly understood. There is no selective mechanism of action, so we categorize it as a miscellaneous antidepressant drug. Example, it is the mianserin, then the bupropion, and second one, it is the trazodone. So these are the miscellaneous antidepressant drug. So these three category of the antidepressant drug can be given for the treatment of the depression. Now let's see the mechanism of action of the antidepressant drug. There was some connectivity issue, so just a minute. Okay. So let's see about the mechanism of action of antidepressant drug. So all antidepressant drug are our first category of the drug that we have studied. What that does, it block reuptake of noradrenaline and 5-hydroxytryptamine. Okay, so what they are doing, it block noradrenaline and 5-HT reuptake. So what is happening due to this? If there is blockage of noradrenaline and 5-HT reuptake, then their level will be increased in the synapse, because during the process of release of this neurotransmitter, for example, the neurotransmitter are released over here, okay? So it will be released through the process of exocytosis of this vesicle, right? And after the binding to the receptor, they will be transported through the monoamine transporter, and after transporting through the monoamine, they will be taken back again into the vesicle, isn't it? So they will be taken back again into the vesicle, right? So if your drug, if it can block this reuptake process, means they are in the synapse, and if they are not going back into the vesicles, isn't it? So if your drug can block this reuptake, then what will happen? There will be increase in level of this monoamine in the synaptic cleft, isn't it? And that is what you need. You want to increase the level of noradrenaline and 5-hydroxytryptamine basically in the synaptic cleft. Okay, so these drugs are doing exactly same. So all tricyclic antidepressant drug, they block reuptake of both noradrenaline and 5-hydroxytryptamine. Since they block reuptake of both noradrenaline and 5-HT, they are non-selective in nature. They are not selective, because there, in some case of depression, patient is suffering from deficiency of only noradrenaline, right? In some case of depression, patient is suffering from a deficiency of only 5-hydroxytryptamine. Now you imagine, if your drug, it is non-selective in nature and it block reuptake of both noradrenaline and 5-HT, then it may contribute to the side effect. For example, if you want to block only 5-HT, and when it block both 5-HT and noradrenaline, the blockage of the noradrenaline, the reuptake blockage of noradrenaline will produce as the side effect. And likewise vice versa. Suppose if you want blockage of only noradrenaline, and if it block the 5-HT, then it produces a symptom of the increase in level of the 5-HT, so that will be the side effect. Okay, so remember that all tricyclic antidepressant drug, they block the reuptake of both noradrenaline and 5-HT, and hence they are called as non-selective antidepressant drug, right? Now second category was SSRI. SSRI, what they does, they block only 5-HT reuptake. So they increases only the level of 5-hydroxytryptamine. So if you want only blockage of the 5-HT, then in such case you can give SSRI. So because they selectively block reuptake of 5-HT and increases the level of the 5-HT in synaptic cleft. Third category was SNRI blocker. So SNR blocker are selective noradrenaline reuptake inhibitor. It is selective serotonin reuptake inhibitor, and this is a selective noradrenaline reuptake inhibitor. It selectively blocks noradrenaline reuptake. So depending upon the patient diagnosis, you can diagnose whether he is suffering from the deficiency of 5-HT or he is suffering from the deficiency of the noradrenaline, and accordingly you can give either SSRI or SNRI, right? So this can be given for the treatment of the depression. Last category, it is monoamine oxidase inhibitor. They prevent metabolism of the neurotransmitter, and they increases their level in the synaptic cleft. So the level of both 5-HT and noradrenaline, it is increases with the monoamine oxidase inhibitor. So this is about the summary of mechanism of action of antidepressant drug. Let's see the first category, that is tricyclic antidepressant drug. So as a name indicates that it is the tricyclic, and it is closely related to the structure of the phenothiazine. So phenothiazine, where we have studied phenothiazine especially in case of antipsychotic drug like chlorpromazine, it is phenothiazine. So all tricyclic antidepressant drug, their structure, it is closely related to the phenothiazine. Let's see mechanism of action. So just now we have seen it compete for binding site of amine transporter, right? So suppose if these are the synaptic cleft, so this is the synapse of the one of the neuron, this is synapse of the another neuron, right? So this is the pre-synapse, this is the post-synapse. Now suppose this is the transporter are present over here, right? So what is happen when in the process of reuptake, when these monoamine, when they are taken back into the synapse, like if from the vesicle, when they are taken back into the synapse, they need specially the amine transporter. So they are transported back into the synapse, or reuptake process, it is occur with the help of amine transporter. So amine transporter, basically they help in reuptake process. Now what happens when you give tricyclic antidepressant drug? It will compete for binding site of the amine transport, means this drug will bind to amine transport. As a result of that, the noradrenaline and 5-HT will not be transported back into the synapse, right? Because these drugs are blocked by the tricyclic antidepressant drug. Amine transporter are blocked by the tricyclic antidepressant drug, so they will not taken back into the synapse, and as a result of that, their concentration, it is increased in synaptic cleft. So that is what the mechanism of action of tricyclic antidepressant drug is. So they block reuptake by having competitive binding with the amine transporter. So they block uptake of the amine, both noradrenaline and 5-HT. Let's see pharmacological action. So which symptom it is improved? So the improvement of emotional symptom, it reflects enhancements of the 5-HT mediated transmission, whereas if there is improvement of the biological symptom is there, it reflects enhancements of noradrenaline mediated transmission. So if the patient is suffering from both biological symptom and emotional symptom, then tricyclic antidepressant drugs are one of the ideal medicine, because they are non-selective in nature. They increase in the level of both 5-HT as well as 5-HT as well as noradrenaline. Okay, whereas if you want to only improve emotional symptom, right, then you have to give the SSRI. If you want to only improve the biological symptom, then in such case you need to give SNRI, that is selective noradrenaline reuptake inhibitor. So this is how you can choose the drug. So this is the pharmacological action of the drug based on how it inhibits the neurotransmitter, or which neurotransmitter their reuptake it is inhibited by the tricyclic antidepressant drug. Okay. Now next important thing about the treatment of this drug, it is what happened first. Okay, so the first few days of the treatment with the tricyclic antidepressant drug, it produces the side effect like sedation, confusion, and motor incoordination. So these side effects are seen in first few days of the treatment, whereas there is no antidepressant effect in first few days. Okay, then once treatment it is continued, then in such case after continuing of that particular treatment, slowly patients start showing the pharmacological action. Okay, so let's see what happened in first 2 weeks, okay, and what happened at the end of the treatment. So when you start the treatment with antidepressant drug, first 2 weeks of the treatment, it shows the side effect, isn't it? And patient has to tolerate that particular side effect in order to get the good improvement in case of antidepressant therapy. So the first few weeks it produces a side effect, and after that slowly these side effects are disappear and patients start showing therapeutic effect. So that drug start showing therapeutic effect in between 1 to 6 weeks. So it's depend, and it may change from patient to patient. Some patient they respond to antidepressant therapy right from start of the treatment, maybe from within 1 week they start showing the improvement, whereas some patient they start showing the improvement maybe after the 2nd week. So from 2nd week onward they start showing the improvement, and if there is no improvement up to 4 weeks of the TCA treatment, then this is the indication. This indicates that in that patient you need to change the medicine, you need to switch over to some another category of antidepressant drug. So this is how you can give the pharmacotherapy of the depression. So this is about the pharmacological action of the antidepressant. So point to be remember is the antidepressant drug first side effects start. Okay, the patient has to tolerate the side effect, and after that the drug starts showing therapeutic effect. Let's see what are the side effect and unwanted effect of the tricyclic antidepressant drug. Okay, so unwanted effect of tricyclic antidepressant drug including anti-muscarinic effect, because as I have mentioned, TCA are non-selective. They are not only producing effect on noradrenaline 5-HT, but they also produces the effect on acetylcholine. So they are anti-muscarinic in nature. So it produces different anti-muscarinic effect. They produces the postural hypotension. What is postural hypotension? The patient, when he is standing, there is no decrease in the blood pressure, but when he sleep, he is suffering from the blood decrease in the blood pressure. So that indicate that the patient may be suffering from the postural hypotension. So this may be due to its effect on adrenergic transmission. Second adverse effect, it is tachycardia and arrhythmia. So this is the effect of TCA on the cardiovascular system. So it produces increase in heartbeat, which produces the tachycardia as well as arrhythmia. So quinidine types of effect it is seen with the tricyclic antidepressant drug. Likewise, it produces the sedation due to long duration of action of the TCA. So it may affect the day-to-day activity. So the daytime performance it is affected because it produces the sedation, right? And lastly, very important problem with the TCA, it is weight gain. So antidepressant therapy, the patient gain the weight, and that is generally embarrassing, especially in case of the patient who are who are very sensitive to their weight. Okay, so the weight gain it is another problem. It produces the sexual dysfunction. So ejaculatory issue it is seen in case of the male. So there is no ejaculation of the sperm. So these are all the problems which are seen with the tricyclic antidepressant drug. Okay, let's see drug-drug interaction of the TCA. And as we have seen that the TCA treatment pharmacotherapy it is also tricyclic antidepressant drug. So it likely to cause adverse effect when given in conjunction with the other drugs. So let's see which are those drugs which produces the problem with the TCA. So first one it is alcohol and anesthetic agent. So we know that the alcohol, what it does, it produces the depression of the central nervous system. Okay, so alcohol produces the depression of central nervous system. Anesthetic agent also produces the depression of the central nervous system. And just now we have seen the TCA, tricyclic antidepressant drug, they also produces the sedation. So this sedation it indicates depression of the central nervous system, right? So what will happen when these drugs are given together? Obviously it will potentiate the inhibition of the central nervous system. So there is more and more inhibition of the central nervous system. It is seen when anesthetic agent and alcohol it is given along with the TCA. So TCA should not be given along with the in case of alcoholic patient or when the patient has to undergo the anesthesia, like during the minor surgery or major surgery. If patient is on the treatment with the TCA, then at least for that particular day, you should not give the TCA, otherwise it will produce very severe depression of the central nervous system. So sometimes this depression of CNS, it is to the extent where patient may die. So death may occur because it may produce severe respiratory depression, isn't it? Because your respiratory system, there is one center in that is respiratory center, it is also present in the brain. So inhibition of the CNS, it will also produce the inhibition of your respiratory center and it may produce the death in that particular patient. So you must take care if alcoholic patient is there or you have to give the anesthesia, then it should not be co-administered along with the tricyclic antidepressant drug. Okay, so this is the first interaction. Second severe interaction which is seen in case of antihypertensive drug. So the TCA interfere with the action of various antihypertensive drug and it produces potentially dangerous consequences. So it actually reverses the effect of the antihypertensive drug. It does not produce the antihypertensive action, and as a result of that, it increases the blood pressure. Okay, and we have seen the TCA they produces also tachycardia. It produces the arrhythmia along with the increase in hypertension because antihypertensive drugs are not working. It produces hypertensive crisis, which is very dangerous for that particular patient. So such patient require close monitoring. So if you know that patient is on treatment with antihypertensive drug and they are given with the TCA, then such patient should be closely monitored in order to avoid the dangerous consequences which is produced by combination of the TCA and antihypertensive drug. So this is the second interaction of the TCA and the drug. Okay. So this is all about the drug-drug interaction. Now let's see about the acute toxicity of the TCA. What are the toxic effect of TCA seen in patient? So it is basically the dangerous in overdose. Why? It is the commonly used drug for the suicide. So it is, if patient want to conduct the suicide, so he may commonly use the tricyclic antidepressant drug to do the suicide. Now why it is dangerous in case of the overdose? Now let's see the reason. First thing, it lower the threshold for convulsion. Means convulsion it is occur after certain threshold of the excitement of the CNS. But what these drugs are doing, they reduce this threshold. As a result of that, even small or even the less excitement of the CNS may produces the convulsion in patient. So since it lower the threshold of the convulsion, it is dangerous drug. Secondly, it produces cardiac conduction defect. So this is another problem. Again, both the CNS and your cardiovascular system are the vital organ. So that is the reason why TCAs are dangerous in case of overdose. Next thing we will see about the pharmacokinetics. There also you can witness again why TCAs are dangerous in case of overdose. So the first reason is that in case of pharmacokinetic of TCA, they bind strongly to the plasma albumin. So they having the binding of 90 to 95%. Okay. Now we'll see later on what will happen due to this binding. Second thing is that it also bind to extravascular tissue, right? So TCA are binding also to extravascular tissue. And as a result of that, now you suppose patient has taken overdose of the TCA or he has taken that drug for suicidal purpose. Now if such patient come into the hospital, then generally what you are doing in case of overdose, you undergo or you carried out the process of the hemodialysis, right? But here, since the drug it is bind to the plasma albumin and it's bind to the extravascular tissue, it is very difficult to remove that drug by the process of hemodialysis. So hemodialysis, it is ineffective to remove the drug. So once patient consume the tricyclic antidepressant drug at overdose, that produces the life-threatening effect that is very dangerous, because the recovery of patient it is very difficult, because it produces because it having the very strong binding to the plasma albumin and it's bind to the extravascular tissue. So hemodialysis it is ineffective to remove that particular drug. So this is the reason why TCA are dangerous in case of overdose. Okay. So this is all about tricyclic antidepressant drug. Let's see about second category of the drug, that is SSRI. So example it is fluoxetine and paroxetine. So this is selective serotonin reuptake inhibitor. So it is most commonly prescribed group of antidepressant, because TCAs are, we have just now seen, they are dangerous in overdose, they produces many side effects. Some side effects are difficult to tolerate. So the TCA are not widely used drug, but SSRI are most commonly prescribed group of antidepressant because they are selective and they having the less side effect. Why they are most commonly prescribed? So they are less likely to cause anticholinergic side effect because they are selective in nature. They produces the action only on 5-HT. They does not produces the muscarinic action. Okay. So since they are selective only to the 5-hydroxytryptamine, they are having the less side effect. Okay. Likewise, they are less dangerous in overdose. We have seen in case of TCAs, they are very dangerous because they produces effect on CNS. They reduces the threshold of convulsion. They produces the effect on the cardiovascular system, which is vital organ, right? And they are difficult to remove by the hemodialysis. So they are more dangerous, whereas SSRI, this is not the case. So they are less dangerous in case of overdose. And in case of depression, the suicidal tendency is common thing. So sometimes patient take more medicine to do the suicide, or take maybe entire strip of the medicine to do the suicide. So if that is the case in case of SSRI, it does not produces dangerous effect in case of overdose. So they are generally safe, and hence they are most commonly prescribed group of antidepressant drug. Okay. Third thing, they do not cause the cheese reaction. So in next lecture we will see the cheese reaction. So it is generally happen with the food and the antidepressant drug. So SSRI do not cause the cheese reaction. Fourth thing, it can also treat anxiety disorder like obsessive compulsive disorder, right? So due to all these 4 important reasons, the SSRI are most commonly prescribed group of antidepressant drug. Let's see about pharmacokinetics of the SSRI. So pharmacokinetics, it is very good. They are well absorbed. Plasma half-life, it is 15 to 20 hours. So no need to give the frequent dosing because it having long plasma half-life. example, it is paroxetine and fluoxetine. What they does, they inhibit hepatic metabolism of the tricyclic antidepressant drug. So this is something which is dangerous. So since it produces inhibition of hepatic metabolism of tricyclic antidepressant drug, now you imagine if TCA are given along with SSRI. So when TCA it is given in combination with SSRI, what SSRI will do? SSRI will inhibit the metabolism of TCA, and as a result of that, automatically there is increase in level of plasma concentration of tricyclic antidepressant drug. So you have not given overdose, but since you have given selective serotonin reuptake inhibitor along with the TCA, it automatically inhibits their hepatic metabolism and it produces increase in level of the tricyclic antidepressant drug. So since it increases the level of the TCA, it increases the TCA toxicity. So there is increase in risk of TCA toxicity. So they are not used in combination with tricyclic antidepressant drug. So this is very important. Remember that the TCA are not given in combination with SSRI. Sometimes this question come in exam. Why TCA is not given in combination with SSRI? Because they inhibit hepatic metabolism of tricyclic antidepressant drug. They increase the level of the TCA, and that increase in level of the TCA, it may increase the risk of TCA toxicity, and hence they are not used in combination with tricyclic antidepressant drug. Okay, let's see what are the side effects of SSRI. SSRI produces a nausea. They produces the GIT disturbance. It also produces the headache, nervousness, insomnia, and the sedation. So although these side effects are there, but they are not as severe as tricyclic antidepressant drug. Okay. In addition, it produces anorgasmia in case of female. So anorgasmia, it is the sexual problem with the female, right? Whereas impotence, it is the sexual problem with the male. So impotence, it is something which is related to male, so easy to remember. So it produces the problem in the male, whereas anorgasmia is the problem which is related to the female. Okay. So the sexual inhibition, it is happening in case of both male as well as female. It also produces possible fetal interaction with monoamine oxidase inhibitor. So just now we have seen it is not given with the TCA. Likewise, it is not also given in the combination with the monoamine oxidase inhibitor. So in next lecture we will see what type of interaction it produces with monoamine oxidase inhibitor. At this time, you remember that it is not given in combination with the monoamine oxidase inhibitor because it produces possible fatal interaction with the monoamine oxidase inhibitor. Okay, so this is all about side effect of the SSRI. Let's see one of the very peculiar symptom which is seen with the serotonin, selective serotonin reuptake inhibitor and monoamine oxidase inhibitor. So when these drugs are given together, suppose if psychiatrist has prescribed both SSRI and monoamine oxidase inhibitor as a combination, right? So why they are not given in combination? Because we have just now seen it produces potentially fetal interaction. Now what is that potentially fetal interaction? When these drugs are given together, they basically produce the group of symptoms which are due to increase in level of 5-HT, which are due to increase in level of 5-hydroxytryptamine. Since these symptoms are due to increase in level of 5-hydroxytryptamine, these group of the symptoms, they are called as serotonin syndrome. Why they are called as serotonin syndrome? Because these are occur due to increase in level of 5-HT. Because SSRI, they increase the level of 5-HT. When you give monoamine oxidase inhibitor, it also increase the level of 5-hydroxytryptamine. So these group of symptoms are called as serotonin syndrome. Now let's see what are those group of the symptoms. So patients suffer from autonomic instability, where there is the liable heart rate and the blood pressure. So the heart rate and the blood pressure, they are unstable. So that is very important problem, because the instability in the heart rate and blood pressure should not be tolerated, because it is very vital organ in order to keep patient alive. Okay. Second thing, it produces the hyperthermia, so increase in your body temperature. So increase in body temperature, it is another problem. So hyperthermia. Second one, it is rigidity, that is resistant to the passive movement. Patient is not able to walk, not able to move, not able to move his limbs. Okay, so this is the rigidity also seen in case of the patient. It also produces the confusion and delirium. and it produces the seizure, that is the convulsion, and in severe case patient may suffer from the coma. Okay, so looking at all these side effects, giving the SSRI and monoamine oxidase inhibitor, it is not advisable. All are very fatal side effect, or it is very fatal drug-drug interaction between SSRI and monoamine oxidase inhibitor. So this is the reason why monoamine oxidase inhibitor or why SSRI and monoamine oxidase inhibitor are not given together, because they produces serotonin syndrome due to excessive increase in level of 5-hydroxytryptamine. Okay, so we are done with today's session. Let's quickly go through question and answer. I know I am late today. So my first question is, give indication for the treatment of antidepressant drug. So we have seen the 3 indications for the treatment of antidepressant drug. Yes. So what are 3 indications of antidepressant therapy? In which case we give antidepressant drug? So in short. Okay, so that is panic and phobia. Neither given the right answer. Obsessive compulsive disorder, yes, and depression. So these are 3 indications in which we give antidepressant drug. Very good. Saqib has also given the answer. Aksa, Roman Sayyad, right answer, it is panic and phobia. Very good. So the antidepressant drug, they are generally given in case of 3 cases, that is panic condition, phobia, and in case of obsessive compulsive disorder, and lastly if patient is suffering from the depression. Okay, my second question is, identify the category of the phenelazine. We have seen the classification of antidepressant drug. Now tell me, what is the category of the phenelazine? Where we have seen phenelazine? What is the category of phenelazine? What is the category of phenelazine? Very good. Aksa given right answer, it is monoamine oxidase inhibitor. Very right answer. So phenelazine, it is monoamine oxidase inhibitor. It is a MAO inhibitor. Right answer. My third question is, select potentially risky drug interaction with the TCA, whether it is alcohol, anesthetic agent, or antihypertensive drug. Which one is potentially risky drug interaction, or you can say the potentially dangerous drug-drug interaction with the TCA? Which drug-drug interaction of the tricyclic antidepressant drug, it is potentially risky? So I have shown you 3 kind of: alcohol, anesthetic agent, and antihypertensive treatment. Okay, Dabir saying alcohol, Uzma saying alcohol, okay, antihypertensive drug, okay. Yes, so all the option I have mentioned, they are right. So all the option, like in case of alcohol, anesthetic drug, as well as in case of antihypertensive treatment, the tricyclic antidepressant drug, they produces potentially risky or dangerous drug-drug interaction. So you all are right. Okay. My last question is, which among the below is dangerous drug in case of overdose? Either TCA is dangerous or fluoxetine, it is dangerous in case of overdose. So from this drug, which is very dangerous drug in case of overdose? Whether TCA or it is the fluoxetine. Yes, I am waiting for answer. Very right, Aksa, Nurunnisa, Uzma. They said TCA, tricyclic antidepressant. So you are right. TCA are very dangerous because they produce effect on CNS, produces the convulsion, having the effect on the cardiovascular system. They are very difficult to remove by the hemodialysis because they bind to the plasma protein and extravascular tissue, and this make them very dangerous in case of the overdose. Okay, so I have done with my session. So thanks for watching my session. If you like this lecture, then do remember to give me a thumbs up. You give me some time, I will be releasing attendance sheet, attendance link in the chat box. So you say done after giving the attendance, and then you can leave the session.